Kenya's health minister has said it is not sustainable for insurance companies to cover COVID-19. Currently, some providers do cover costs at designated government facilities. But as CGTN's Enock Sikolia reports, many patients are left with huge hospital bills.
Benson Musungu was insured when he first entered the emergency room. Doctors at Aga Khan Hospital in the Kenyan capital, Nairobi, thought he had pneumonia. After 3 days of hospitalization, he received a COVID-19 diagnosis and his situation changed.
They told me that because it was an epidemic, epidemics are never covered across the world. And you see, I went there not knowing that I'm going to use my money because I knew I was going to do it, to use a cover. But the cover now has been withdrawn. Now I'm on my own.
15 days in the ICU had left him with a hefty bill, all to be paid out of pocket. By the time he was recovering, the total was over $22,000. The cost of protecting doctors, nurses, nutritionists, and cleaners was passed on to him. Musungu says he had to pay $270 per day just for PPEs.
And that is nothing to do with medication. It's about protecting the person who is coming to see a COVID patient. And that is only the PPEs. Now, we go to oxygen. Oxygen at Aga Khan per hour is 300 Kenya shillings. That's $3. $3 by 24 hours. Then times this 15 hours, 15 days I was in hospital. Yes, in the ICU. So you can tell me how much that is.
Dr. Ahmed Omar, the Deputy Director at the Africa CDC, explains that supportive care is where the accumulation of bills begins.
Supportive treatment will require special equipment. It requires specialists. It requires different combinations of medications. And all these combinations of medications take time. So you'll find someone in hospital for at least 10 days. Most of them are above 2 weeks. And every day, some procedure or the other is being done. That is what makes it expensive.
With the management of COVID-19 becoming a very expensive affair for a majority of the African population, Africa CDC says African governments can do a lot to help.
Governments can be able to subsidize the costs by one, being the ones who are procuring what is required, because then they procure it at a pooled procurement rate, which is less than out in the private sector. They don't make a profit. So it means what is being passed on to the patient becomes less.
With a second wave of COVID-19 infections making its way through the Kenyan population, Dr. Omar maintains that knowledge and personal responsibility remain the best weapons against the highly contagious virus. Enock Sikolia, CGTN, Nairobi, Kenya.